Hello, and welcome to the SNF Training Part 1. I'm Brenda Karkas, and I'll be presenting Section O, Special Treatments, Procedures, and Programs. I'm a registered nurse with experience in direct patient care, education, and nursing administration. My experience includes inpatient care, outpatient oncology, home health, and hospice settings. Currently, I'm an associate nurse researcher at Apt Associates. Let's just review the objectives for this lesson. I'm going to summarize the updates in Section O, describe the new assessment period columns in O0110, Special Treatments, Procedures, and Programs, and discuss the new data elements in O0110 with expanded choices for coding. O0110 is a revised data element that replaces O0100. It has a new number and new examples have been added to the manual. The columns have been revised. The column, while not a resident, has been removed. Two new columns on admission and at discharge have been added. Several data elements have been expanded. They now have some elements to include more detail when coding. And here are a few more changes I'll highlight in Section O. For O0250 influenza vaccine, a change has been made to the coding tips to include a reference for when facilities must offer residents the influenza vaccine. For O0400 therapies and O0425 Part A therapies, there are some clarifications that were added regarding uninterrupted stay. We suggest you refer to the manual to review these changes. Here's the intent for Section O. You can see that there is only one minor change to the statement. It's marked in orange. This now reads, the intent of the items in this section is to identify any special treatments, procedures, and programs that the resident received or performed during the specified time periods. Now let's review in detail the actual changes to this data element, O0110, and the corresponding changes in the updated manual. This is just a screenshot of this new data element. We'll look at this in a little closer detail on the next few slides. In this close-up of O0110, you can see that there are two new columns, on admission and at discharge. You can also see some of the sub-elements that have been added to A1 chemotherapy. You will now choose which type of chemo, either IV, oral, or other. In this screenshot, you can see that column B, while a resident, is highlighted. And note that the choice for IV access has now been added for all three columns. This slide is just highlighting the change in the steps for assessment. It now states to review the resident's medical record to determine whether or not the resident received or performed any treatments, procedures, or programs within the assessment period defined for each column. And here are new coding instructions for column A on admission. You will check all treatments, procedures, and programs received by, performed on, or participated in by the resident on days 1 to 3 of the SNF PPS stay, starting with A2400B, which is the start date of the most recent Medicare stay. If no treatments, procedures, or programs were received or performed in the 3-day assessment period, you will check Z, none of the above. And this slide is showing you the revised coding instruction for column B, while a resident. You will check all treatments, procedures, and programs that the resident received or performed after admission, entry, or re-entry to the facility and within the last 14 days. And if no treatments, procedures, or programs were received by, performed on, or participated in by the resident within the last 14 days or since admission, entry, or re-entry, you'll check Z, none of the above. And lastly, the new coding instructions for column C, at discharge. Check all treatments, procedures, and programs received by, performed on, or participated in by the resident in the last 3 days of the SNF PPS stay, ending with A2400C, which is the end date of the most recent Medicare stay. And if no treatments, procedures, or programs were received by, performed on, or participated in by the resident in the 3-day assessment period, check Z, none of the above. And now I'll review the new or revised coding tips for this data element. O0110A1 chemotherapy. On this revised coding tip, you can see in orange, the number has changed. There is also a number change for section K noted here as well. The tip now reads, IVs, IV medication, and blood transfusions administered during chemotherapy are not recorded under items K0520A, parenteral IV, O0110H, IV medications, or O0110I, transfusions. As I pointed out on the screenshot earlier, here are the details of those new sub-elements for chemotherapy. You will check IV if chemotherapy was administered intravenously. And you'll check oral if chemotherapy was administered orally through pills, capsules, or liquids that the resident swallows. And this sub-element also applies if the chemotherapy is administered through a feeding tube or a PEG tube. And for A0110A10, other, check if chemotherapy was given in another way other than intravenously or orally. These might include intramuscular, intraventricular, intraperitoneal, or topical routes. And here are new coding tips for the additional sub-elements for oxygen therapy. There are 3 options to choose from: continuous, intermittent, and high concentration. You'll check continuous if the oxygen was continuously delivered for 14 hours or greater per day. You would check C3, intermittent, if the oxygen was intermittent, which means it was not delivered continuously for at least 14 hours per day. And lastly, you would check C4, high concentration, if the oxygen was provided via a high concentration delivery system. The next few slides will give us a little more detail on coding high concentration oxygen. For O0110 C4 high concentration, a high concentration delivery system is one that delivers oxygen at a concentration that exceeds a fraction of inspired oxygen, or FiO2, of 40%, exceeding that of simple low-flow nasal cannula at a flow rate of 4 liters per minute. A high concentration delivery system can include either high or low flow systems, such as simple masks, partial or non-rebreather masks, face tents, Venturi masks, aerosol masks, and high flow cannula or masks. And here's one other new coding tip for high concentration. These devices may also include invasive mechanical ventilators or non-invasive mechanical ventilators or trach masks if the delivered FiO2 of these systems exceeds 40%. Oxygen-conserving nasal cannula systems with reservoirs, such as a mustache or a pendant, should be included only if they're used to deliver an FiO2 of greater than 40%. Now let's look at the coding tips for the new sub-elements found under O0110 D1 suctioning. You'll check scheduled if the suctioning was scheduled and performed when the resident is assessed as clinically benefiting from regular interventions, such as every hour or once per shift. Scheduled suctioning applies to medical orders for performing suctioning at specific intervals and/or implementation of a facility-based clinical standard, protocol, or guideline. If suctioning was performed on an as-needed basis, you would check D3 as needed. And this is further defined that as needed as opposed to irregular scheduled intervals. Some examples might include when secretions become prominent, such as the patient is gurgling or choking, or a sudden desaturation occurs from a mucus plug. And this slide depicts a revised coding tip for O0110 E1 tracheostomy care. You can see the changes in orange, and this now reads, code cleansing of the tracheostomy and/or cannula in this item. This item may also be checked if the resident performs their own tracheostomy care or receives assistance. This item includes laryngectomy tube care. Here are the coding tips for the new sub-elements under O0110 G1 non-invasive mechanical ventilator. These are BiPAP and CPAP. You would check BiPAP if the non-invasive mechanical ventilator support was BiPAP, and CPAP if the non-invasive mechanical ventilator support was CPAP. For O0110 H1 IV medications, there is a change to the instructions regarding lactated ringers. It now reads, lactated ringers given IV is not considered a medication and should not be coded here. Resources and tools providing information on medications are available in Section N of the manual. And here are the new coding tips for the sub-elements in this section, IV medications. We have H2 vasoactive medications. Check when at least one of the IV medications was a vasoactive medication. And H3 antibiotics. Check this when at least one of the IV medications was an antibiotic. For O0110 H4 anticoagulation, check when at least one of the IV medications was an IV anticoagulant. Do not include subcutaneous administration of anticoagulant medications. And for O0110 H10 other, check when at least one of the IV medications was not an IV vasoactive medication, an IV antibiotic, or an IV anticoagulant. Examples might include IV analgesics, such as morphine, or diuretics, such as furosemide. Here are some new coding tips for O0110 J1 dialysis. And basically, you will check hemodialysis when the dialysis is hemodialysis, and check J3 peritoneal dialysis when dialysis was peritoneal. These are both defined here on the slide as well. And here are some new coding tips for O0110 O1 IV access. You code IV access, which refers to a catheter inserted into a vein for a variety of clinical reasons, including long-term medication administration, large volumes of blood or fluid, frequent access for blood samples, intravenous fluid administration, TPN, or in some instances, the measurement of central venous pressure. And lastly, a few more coding tips for O0110 O1 IV access. You would check peripheral if the IV access was and remains peripheral. Check midline when IV access was midline. Midline catheters are defined here as those inserted into the antecubital or other upper arm vein and do not reach all the way to the central vein, such as the superior vena cava. And the last choice here is O0110 O4 central, which would be for a PICC line or a tunneled port. In summary, a revised data element, O0110, Special Treatments, Procedures, and Programs, has replaced the original data element, O0100. This revised data element includes new assessment periods, expanded sub-elements for more detailed coding, and some new examples are in the manual. In closing, if you have questions about this presentation, please submit them to pactraining@econometricainc.com by June 2nd, 2023. As a reminder, a practice coding workshop will be held in June, and we do encourage you to attend. Select questions will be answered in the Q&A session during this June 2023 virtual live event. Thank you for reviewing this presentation, and we look forward to your attendance at the coding workshop.